Let's talk infection rates, vaccinations, hospitalizations. What are the numbers? Where are things now? Where are they going?
Well, I can tell you that in general, we are in a low. We're in a low point here with cases and hospitalizations. And what that means is when we think about the pandemic, we're really thinking about this in a cycle. We're thinking about different approaches depending on where things are overall in the state. And right now we are in a recovery phase. And what that means is that we just got over this big surge in the winter. We just got over our Delta and Omicron surges back to back. We now are in a place where transmission is low, and we do have some protection based both upon vaccination as well as some prior immunity from that very recent Omicron surge. So we're in a relatively good spot at the moment. However, when we think about where we're heading in the pandemic, we do expect to see future surges of cases. We do expect cases and hospitalizations even to go up at times in the future. And when we think ahead, what does that look like? That could be the emergence of a new variant. It could be schools reopening in the fall. We have seen surges of cases around school reopening in the past. It could be around colder weather in the winter. So we're looking at this as really being a phased approach to the pandemic. We're in recovery right now, but that doesn't necessarily mean that it is all smooth sailing, because as you know, we have the BA2 subvariant that we are closely monitoring. And it's causing increased cases in other parts of the world and in other parts of the country. And we do expect to see a rise in our cases here in Michigan.
But on top of that, we're also looking at that push for that second booster. How does that fit into all of this?
Well, again, vaccines are one of the most important tools that we have. We really have to use all of these tools in a very holistic approach and use them together. So you are safest if you are using our what we call non-pharmaceutical interventions, meaning you're avoiding very large, very crowded gatherings. You're doing what you can to prevent getting exposed to the disease as much as you can. And then also you are making sure you're vaccinated and boosted, so up to date with vaccinations, that you've spoken to your doctor, that you have a plan for whether or not you'd be eligible for one of these COVID therapeutics, and then making sure that you've got some of these tools at home. So making sure that you've got masks and hand sanitizer on hand for future surges, making sure that you've got over-the-counter tests on hand so that you can use those over-the-counter tests if you become symptomatic, if you've been exposed to someone with COVID, or before attending a large gathering. So making sure that people have all of these tools at their disposal is really one of the keys to moving forward.
A federal judge just very recently, kind of lifted this mask mandate on airplanes and transportation. What about that? What do you think? Will you still be wearing your mask on a plane now?
We have been saying for some time now that we're in a phase of the pandemic where making these sorts of decisions are really up to individuals. So we now have access to well-fitting, high-quality masks that can protect the wearer. In the beginning, when we were talking about cloth masks and masks that were not well-fitting, really everyone had to wear a mask in order to prevent spread from happening. But now, if you are wearing a really high-quality, well-fitting, multi-layered mask, you can provide protection to yourself. And so people need to make decisions that work for them. So we still recommend wearing a mask if you are unwell, if you've tested positive, if you are quarantining, for example. So there are still some times where we would recommend masking. If you're in a high-risk congregate setting, so if you're in a healthcare setting or a long-term care facility, that's another time to mask up. And then we also want people to comply with local and federal rules. So if there are any laws, mandates, rules around masking in the place you're going to, it's important to comply with those rules. But overall, people can now make decisions that work for them. And there are lots of different reasons why people may want to continue wearing a mask. So number one, you may have young children who aren't eligible for the vaccine yet. You may be immunocompromised yourself. Someone in your family may be immunocompromised. You may be wearing a mask for them. And then there's also just wearing a mask to be considerate to others. You don't know who's around you. You don't know if there are people who are very vulnerable who are sitting next to you. And so you may wear a mask for them and for their comfort. And so when you ask if I will continue wearing a mask, I do generally wear masks when I'm in public, when I'm in especially indoor public settings. But again, it's a personal decision that I make with my family and do what's best in for us. And people have to make those decisions for themselves as well.
Yeah, you mentioned your family, children. How are schools doing in dealing with all of this these days?
I think it has been a very hard 2 years for schools. I think schools have been put at the front line of this pandemic, and really they want to get back to the business of educating our kids, which is their primary goal. But they also need to be able to stay open and make sure that kids are healthy enough to be able to stay in school, and that does mean preventing outbreaks. And when I talk about those tools, and I mentioned that vaccines are one of the most important tools that we have, we see that vaccines have not been utilized to the degree we would want them to be in our younger age groups. So when we look at overall vaccination, we're at above 60% for vaccine uptake across the state. But when we look at our younger age groups, when we look at our pediatric population, the 5 to 11 population, that's lower. That's at about 28% statewide. And then when we look at certain communities, that rate, especially in children, drops even lower. And when we look at communities of color, again, we're seeing lower vaccine uptake. And that matters because we are expecting future surges of cases. And we need to make sure that everyone and all communities across the state are protected. So if we don't have vaccine uptake in that younger age group, we could be seeing school closures again in the fall, school closures into next year and even beyond. We could be seeing outbreaks in schools. And then, of course, we know that children who are exposed and transmitting in school settings, for example, can bring those infections back to their family members and to vulnerable grandparents or younger siblings. So we really need to make sure that vaccine rates are up across the board, because if we are not all protected, if we have vulnerable individuals, vulnerable communities among us, then as a state, we're not going to be able to move out of this pandemic.